So, as everyone is very well aware, the Public Health Service Task Force disrecommended PSA, and this year unrecommended the disrecommendation. Talk about confusing. So the way we think about this now is that PSA is like opening the door. It's not diagnosing prostate cancer, it's just telling somebody what their risk of prostate cancer is. I was just talking to one of my colleagues from Ghana, and their average PSA when they walk in the door is over 20. Well, that's African American, that's an African population. So you can not make a diagnosis of prostate cancer without doing a PSA. So you need the PSA. From that point on, you want to then go quietly and make a diagnosis. More and more, we are then going with an MRI. So the MRI then gives you the anatomy of the prostate, gives you whatever target lesions there are. We have the 5 categories, 1, 2, 3, 4, and 5. You can ignore 1, ignore 2, 3 maybe, 4 you can't ignore, 5 you can't ignore. Those are called PIRADs. And so when you get the MRI, then you go, okay, you need a biopsy. Now, some urologists do it the other way around. They get the PSA and they do the biopsy. But to me, it doesn't make sense. You want to do an anatomy exam of the prostate. And when you do that, then you can decide what the likelihood of having cancer is before you do the biopsy. Biopsy costs money. It causes bleeding and infection in 4% of patients. So you go PSA test, open the door, you look at the prostate with an MRI, and then you should do the biopsy. And that then gets us down the road. Now, if you find a particularly bad lesion, like a 4 or a 5, well, then you got a problem. And the biopsy flows, and then from that point on. So it's becoming more systematic. And for the Gleason 1 or grade group 1 on a biopsy, we know you don't have to operate and you don't have to give radiation, at least not right away. So we're reducing the burden of treatment and we're expanding our area of treating the bad cancers. So I guess the question to every man is not have you had a PSA, but if you've had a PSA, it's abnormal, have you had an MRI? That's the answer.